Libya is struggling to deal with the thousands of bodies being recovered in the aftermath of devastating floods. Overwhelmed officials have registered nearly 4,000 deaths, a number that's expected to rise as more bodies are found. Corpses are washing up on the coast after being swept out to sea when torrential rains caused 2 dams to burst, causing a flash floods that destroyed large parts of the city of Derna. The World Health Organization has urged Libyan authorities to stop burying victims in mass graves to avert future legal and emotional problems. Meanwhile, the Red Cross is warning that the floods may have uprooted landmines and explosives are left over from the country's years of conflict. Despite the many dangers, helpers are scouring the wreckage.
Walking on rubble and shoveling mud-filled floors. The floods have devastated Saad Rajab's house and left him without shelter.
It's not easy. Only God knows what we're going through. We're back to square one. No one helps you. Not even the government has helped us. We've been left out on the streets.
Many survivors are not only homeless now, they are in dire need of food and medical supplies. Across the country, volunteers have been collecting humanitarian aid to send to affected areas. Everyone is doing their bit to help.
This is a time to come together. If we don't cooperate now, then when will we? People have died. Entire families, a city has been destroyed. If we, the residents, not only of this city, but of Libya as a whole, don't come together, then when will we?
Those who are lucky enough to survive that fateful night are struggling to cope with the trauma and to come to terms with what they have lost.
The World Meteorological Agency says the huge loss of life in Libya's flooding catastrophe could have been avoided if the country had had a functioning weather agency to sound the alarm. Other authorities have pointed to the country's systemic corruption and consequent lack of infrastructure investment. But apportioning blame isn't simple in Libya. The country has been plagued by years of conflict and is divided between rival governments in the east and the west. Let's get more on the possible causes of this disaster from Stefan Uhlenbrook. He's Director of Hydrology with the World Meteorological Organization and joins us from Geneva. Welcome to DW. The UNA chief, Martin Griffith, has blamed this catastrophe on what he called climate and capacity. Just talk us through what that means.
Thanks. Good evening. Thanks for having me. Well, the capacity to deal with such disasters is absolutely critical. We see in most countries that it's very limited, and the same is true for Libya. Well, what is a very key investment for countries is investing in early warning systems so that the society can do preventive action, can have an early warning, a lead time before the event, and also can either evacuate or make sure that certain infrastructure stays intact and to really minimize the damage. All the studies that we synthesize at the moment show that early warning systems have very good return on investment. So investments in early warning, and for the countries having then the capacity to also act upon is critical to minimizing the damage of such events.
And so there were no early warning systems and the infrastructure was effectively broken.
Yeah, it's a whole chain, huh? And I understand for this specific event, the meteorological service, they did issue 72 hours before the event a warning, although the state of emergency was declared. But it was uncertain, and it's one thing. You need measurements, but you also need numerical models to make good predictions, and then also to have a governance structure in the country that functions, that works, that is able to to direct the population, and the population need to act, and then there need to be information dissemination. So there's a whole chain of action that need to happen. And even while early warning issues, while the early warning system was there and warning was issued, the whole follow-up, the whole chain didn't effectively function. No.
So this has happened a couple of months ahead of Libya's actual rainy season. Does this mean things there are going to get worse?
Normally, we expect rainfall in northern Africa and that part of the world in the northern hemisphere winter time. So in the period November to February. But now we had this absolutely unprecedented rainfall already in early September, which is very, very untypical. This is also a different rainfall mechanism that was generating these floods. It was more like a tropical cyclone, which we don't expect in this part of the world so much. It's a very rare meteorological phenomenon, but what we observed. And unfortunately, due to climate change, there's a likelihood quite high that we increasingly see such events happening. And then the follow-on effects will be there, yes.
Thank you so much for outlining that so clearly for us. Stefan Uhlenbruck from the World Meteorological Organization.
Pleasure.
The disaster has brought some rare and temporary unity, with the two governments cooperating with rescue and relief efforts. Now responders are struggling to help survivors and to manage the thousands of corpses they're recovering. Officials have been speaking about the most pressing issues they're facing.
One of the things that we need in Libya is the need for equipment to find people in the floods and the sludge and the damaged buildings in Derna and its environs. But also we need those priority areas are shelter, food, key primary medical care because of the worry of cholera, because of the worry of particularly in Libya, the worry of lack of clean water. That's a huge threat to the lives, particularly of children, which is why UNICEF and others are there. But also in a disaster like this, and Libya, as well as Morocco, but Libya is going to be a huge issue, is psychosocial care.
Let's pick up some of those points with Amul Barghouti, who's an Advocacy and Communications Officer with UNICEF Libya in Tripoli. Welcome to DW. What does the Under-Secretary General mean when he talks of a need for psychosocial care?
Hello. Well, psychosocial care means basically children who have experienced those massive destruction of the city, displacement, destruction of homes and also of schools that can be very traumatic for children, and mental health can suffer. The loss of family, familiar settings can lead to feelings of insecurity, fear, and also stress. Psychosocial support addresses the psychological and social needs of individuals, particularly children. Those are affected by trauma. Now, in case of Libya, we have children who was under a traumatic experience when the floods were out, and also now they're experiencing who those survived are experiencing now displacement, and that another trauma for them. In the aftermath of Danielle storm in the eastern of Libya, UNICEF has emphasized the critical need for child protection services, including psychosocial support to help affected children and also their parents process their distressing experiences.
OK, and Martin Griffiths also talked about the need for a clean drinking water to avoid the spread of cholera. What are the practicalities of transporting water into an area with such a catastrophically damaged infrastructure?
We've been saying that, the big challenge now in these days is to get into the city. For sure, you've been hearing a lot of the land falls, the roads falls, the dams burst, which have resulted in a major damage to the infrastructure of the city, the roads that are leading to it as well. But now, thankfully, we have Derna is accessible. with a bit of construction in the entrance, but is still, accessible. But like our team yesterday, today, and also tomorrow are doing this field mission, an in-depth assessment for everything in Derna, and also in Baydan and Marij. We don't want to forget those cities. They're also affected by the storm, and they have like basic major challenges in terms of water, like 18 boreholes are non-functional now, concerning risk of groundwater contamination from.
So it's a big job. Right.
It's a big job.
I'd like now to turn to some of the even grimmer practicalities of a disaster on this scale. We're going to hear from Dr. Margaret Harris from the World Health Organization and then come back to you.
Dead bodies per se are not, especially after a disaster like this, are unlikely to be a health risk. People have died because of the massive flood or the earthquake, not because of an epidemic-prone disease. So therefore, as such, however, there are certain things, for instance, feces from the dead body can contaminate the water if not handled properly. So this is why proper management is critical.
So, Amal Barghouti, we have been hearing about mass graves for the dead who number anywhere between 6,000 and 11,000 and appeals for body bags. What should authorities be doing with so many bodies, so many of them unidentified?
As UNICEF, we're not in a position to give this, technical assessment of what the authorities should be doing. But I think everybody agrees on the, life savings interventions, including rescuing those who are under the rubble. I think they're trying very much to do as much saving as they can. Also, international and neighboring countries are now involved with the rescue teams. They're doing their best to save as much as they can, but also we have a large thousands number of displacements, of displaced people who are in a real need help. They have nothing basically, and there is a lot of risks surrounding those people.
Well, we thank you for joining us and sharing your insights with us, and wish you well in your endeavours. Amal Barghouti from UNICEF Libya, thank you so much.